Hi, my name is Heather and I'm new to YouTube and I have started this site called Hindsight is 2020 and I want to start talking today a little bit about the difference between an acute illness and a chronic illness. There's a difference. An acute illness is when you break a bone and it gets better within 6 weeks, or you get the cold and you get over it within 7 days. And that's because you've got a proper, hopefully functioning immune system that goes directly to the point of the infection to kill either the bacteria or the virus so that you can get better and get past and over your problem. But chronic illness is a whole different animal. Chronic illness is, for instance, if you were in a motor vehicle accident, or in my case, I was assaulted by a psychiatric patient 12 years ago, and within 3 months of very good care, the pain was still there for me or for the motor vehicle accident patient who has been through physical therapy, who has been getting IVs, who's been going through rehab. I mean, just everything. And still after 3 months, he's experiencing pain or she's experiencing pain either all over her body or within a specific spot where she was injured. Now, you still got about 3 more months to work on it, but after 3 months, the doctors start getting concerned. And what they may do at this point is send you off to a pain doctor or a pain clinic. Now, what happened to me is the pain was excruciating, and I did last for 3 months before I gave in and said, okay, I will go to a pain doctor. I did not know that much about pain in the medical field. What I did know, though, is that this particular doctor, and most of the chronic pain doctors are anesthesiologists that are well known for using corticosteroids to decrease the inflammation in painful sites. Well, that can work occasionally, but what it usually does, considering the fact we are only allowed to have this much corticosteroids 3 times per year to decrease inflammation, say it was a bursitis, not usually with a broken neck, but they didn't know it was a broken neck. Again, a problem. And so when you go to these clinics, you're pretty much at the mercy of the doctor and of the physical assistant who is not like a nurse, not trained to care, but trained to write prescriptions for the doctor. And these days we have what they call a war on comfort, where they have taken off the shelf the hydrocodones and made it harder for patients to get comfortable. Now, that's not the only way that you can deal with your chronic pain. However, some people do go into opiates, and we will discuss more about that in my next video because that's something that needs to be talked about. But what I do want to put out there is this. Know who you're going to be seeing. Do not allow them. You actually have a patient bill of rights that they will give you when you sign into their clinic and their policies and procedures. Please be sure to read all of the forms. Please be sure to get them all copied if you're going to sign them, because you may be signing away things that you're not really prepared to be signing away. For instance, your total care to the physician, when you don't agree, you have a right, patient right to say, no, I don't want that treatment. And when you're dealing with things like workman's compensation or insurance companies, they're going to push. They're going to really push for you to be getting those steroid injections because they're very inexpensive. But let me tell you, they will cause more problems than good. They will destroy the internal gut of your intestinal system, which we'll go into later. That will not help with chronic pain at all. They will also help to make it so that you will not be immune. Your immunities will be completely cut off if you get more than 3 shots per year, and that's pushing it. So I had 35, so I ended up not having an immune system on top of having chronic pain. So trust me, I totally understand where you guys are at in your suffering. For the people that do not have chronic pain, understand what it would be like to have perhaps your foot, someone sit down in a steel chair on top of your foot and never get up. Yeah, barefoot. You get grumpy, you get fatigued, you get very tired, and you're really trying to hang in there. You really are, because you don't want to lose it. And you really, it hurts. Because for one, when they destroy your immune system, you have what they call a flare of fire within your body because it wants to clean out what just happened to it because the poison was just put into it, the corticosteroids. And that will literally be what burns out your immune system. So please be careful and ask questions. It's your right. And if the doctor doesn't like you asking questions, that's not your doctor. Doctors will take better care of you if they care about you. Means they're going to ask you questions, they're going to listen, they're not going to call you crazy and send you to the psychiatric addictionologist before you even get in there and get started. But be expecting, if you go to these clinics, to also be urine tested constantly, randomly. It's really almost more pressure than it's worth. And when you're dealing with a chronic illness, your main goal is to stay balanced. Not too high, not too low, anxious, depressed, scared, depressed. I mean, they all go together, and it just makes you sicker because it pulls on an already stressed immune system that's trying to get you better from your chronic pain condition. We're in that little 3-month area there. After you've gone through 3 months, you have a teeny tiny window of 3 months more to get this right and to get healed. Anyway, just say no to steroid injections, period, unless it's life or death. And that's from a nurse that's been around for 30 years. Anyway, I wish it was a better story. And next, we're going to talk about different modalities of pain relief.